there's still a lot of room for us to, do much more research on our African American patient population. But what we know for now, for the most part, what we have gathered is that our African American patients tend to be younger. And although within that it's still like a heterogeneous group and is not applied to everybody, but also tend to it tends to involve our young females, and young meaning younger than that average time of diagnosis, which is like somewhere between 58 to 62 years. Old patients, they are younger, and especially for females, when they're diagnosed younger, they can have more aggressive disease. So, meaning it more easily evolves beyond the skin, the blood, or lymph nodes, and they might be more recalcitrant to standard of care and standard treatment. And so I think that's very important, because that means we have to more closely monitor them, and have a low threshold to restage these patients, meaning look in if there is worsening in their skin, look into the blood, look into their lymph nodes, and making sure there's no visceral involvement, and optimize their treatment management. I think, our job as a tertiary referral center is to help educating our providers, and not only our providers, our patients, our colleagues, what signs to look for. It can be challenging in African American patients, because that sort of classic, what we describe, redness is different in that population, because of the pigment that is on the skin, and might mask that, some of that clinical presentation. You have to look a little bit more closely. That can be especially challenging when there's erythroderma, meaning 80%, more than 80% of the skin is red, but that redness might not translate well when there is pigmentation, basically higher volume of pigmentation in the skin, which we see in darker skin types. So those are, like, you have to listen to the clues that the patients are giving you. For example, if they have diffuse itching, but don't have that sort of redness that you're looking for erythroderma, you should have like low threshold to biopsy. Also, if, so that's one thing, like trying to diagnose the patient, right? But if a patient is diagnosed already and is under care, I think it's very important for providers to work together. This is a disease that I always think it takes a village to really do excellent patient management and treatment, and have the right treatment plan for our patients. So at our center, dermatologists, oncologists, radiation oncologists, dermatopathologists work very closely together, and have like very detailed conversation about each single patient, to make sure that we consider all aspects of their disease, basically influences our patient care, and work very closely together to be able to provide that excellent care for our patient.